Hello, welcome to the Diagnostic Imaging Center. This is the part of the hospital where kids come to get an MRI. MRI stands for Magnetic Resonance Imaging. The MRI is a large, special camera that takes pictures of the inside of your body. When you come for your MRI, you will meet many new people and have some pictures taken with this special camera. But, just like a regular camera that you may have at home, this camera won't touch you and it won't hurt when it takes pictures. When you first arrive, you will check in at the desk in our waiting room. The receptionist will give you a wrist bracelet that has your name and birthday on it, and some paperwork for your parent or caregiver to fill out. After your paperwork is done, you may have to wait in the waiting room for a little while. This is a good time to play, watch a video, or just hang out with the people who came with you. You may bring a toy or an activity from home to do while you wait. Some ideas are a tablet, a small art project, a toy, or your homework. While you are waiting, a child life specialist may stop by to meet you. A child life specialist's job is to make sure that you understand everything that will happen while you're at the hospital and help answer any questions you may have. You can also ask the receptionist to page your child life specialist if you want to talk about your MRI. Sometimes we may need to give you a special medicine called contrast for your MRI. This medicine helps us take pictures of the inside of your body. The contrast medicine is given through an IV tube. An IV tube is a tiny, flexible tube that looks like a straw. It goes into your vein, usually on your arm or hand. If you'll get the contrast medicine through an IV tube, you will go to the Child and Adolescent Center to have your IV tube placed before you come to the MRI area. You can talk with your nurse or child life specialist if you want to learn more about the IV tube. When it's time to get ready for your MRI pictures, the MRI team will call your name and walk you and your parent or caregiver to another waiting area. Here, you will meet a nurse who will ask you and your parent or caregiver some questions. We'll also give you a special pair of pajamas to wear. If you have an IV tube, your nurse may say she's going to flush it. This just means she's going to check and make sure it works well by putting special water in it. Some kids think it feels a little cold. You'll also meet the MRI technologist or tech. This is the person who will take your pictures. Before we start, the tech will ask you to practice lying very still. If you are having an MRI of your chest or stomach area, the tech will ask you to take a deep breath and hold your breath for about 15 seconds. You can try pretending that you are taking a deep breath before blowing some bubbles or going for a swim. If you can't hold your breath for that long, it's okay. You can just take slow, gentle breaths. Let's practice this together. When it's time to take your MRI pictures, the tech will ask if you have any metal on you, such as jewelry or a belt. Then the tech will walk you and your parent or caregiver to the MRI room. The MRI is a large round camera with a hole in the center. Kind of looks like a spaceship or a giant donut. The MRI camera is just like a big magnet, so it's important that nothing with metal on it comes into the room with you. You will see a special bed that looks like a table. This bed moves in and out of the MRI camera. Remember, the MRI camera will not hurt and it will not touch you. Your parent or caregiver can usually stay in the MRI room during your MRI pictures. Your nurse or tech will give you more information about this on the day of your MRI. Next, the tech will help you climb up onto the bed and get comfortable, give you a warm blanket if you are cold, and have you wear a special seatbelt. The tech may also need to put something on you called a coil. A coil helps the MRI camera focus on the part of the body that needs the pictures. It may look like a helmet if you are having pictures taken of your head or brain, and it may look like a giant boot if you are having pictures taken of your leg. These items may be very close to your body and may touch you, but it should not hurt. Please tell the tech if you feel uncomfortable or if something is hurting. Next, the tech will move the bed slowly into the MRI camera. You may enter the MRI camera head first or feet first. This depends on which part of your body is having the MRI pictures. Once you are in the MRI camera, it is very important to lie very still during the pictures, just like a statue. The MRI camera makes a lot of loud noises while it takes the pictures. Some kids say it sounds like a washing machine or a construction site. The tech will give you and your parent or caregiver some earplugs to help with the noise. The tech will help you with the earplugs if needed. We will also give you a special emergency squeeze ball hole. During the MRI pictures, you can squeeze the ball if you have a question, feel worried, or to let the tech know that you need something. MRI pictures are different for everyone, but most MRI pictures take about 30 minutes to 1 hour. That's about the same time as a TV show. This includes getting in and out of the MRI camera. Ask your tech how long your pictures will take. Some kids say it helps to imagine that you are somewhere else during the MRI, like the beach or playing with friends. Other kids just like to rest during the MRI, and some even fall asleep. What do you want to think about during your MRI? During your MRI, the tech will watch you through a camera and will talk to you through a microphone. The tech will remind you to hold still and how much longer you have. If you are having an MRI of your chest or stomach area, the tech will also ask you to take a deep breath and hold it for about 15 seconds. Remember, the most important job you have is to lie very still. The tech will let you know to hold still, when to hold your breath, and when is it okay to breathe again. If you have an IV tube for the contrast medicine, the tech will use a special machine to give you the medicine in your IV tube. This should not hurt. When we are done taking your MRI pictures, the tech will move the bed slowly out of the scanner, remove the seatbelt and any other items, and help you off the bed. If you have an IV, we will remove it unless you have something else scheduled that day. Then you can change back into your regular clothes and leave. A special doctor, called a radiologist, will look at the pictures. This may take a little while, so you might not know the results on the day you have the MRI. When the results are ready, the doctor will talk to you and your parents or caregivers. Now that you know what to expect with your MRI scan, there are some things you can do at home to prepare for it. You can practice holding your breath for about 15 seconds, or take slow, gentle breaths. Practice lying very still like a statue while your parent or caregiver takes pictures of you with a camera or phone. What happens to the pictures when you wiggle around? You can also think about which parent or caregiver you would like to come with you on the day of your MRI, and choose a special activity or a favorite toy to bring with you. Also, there's another video that we suggest you watch. It's about having an MRI scan, but with anesthesia. We will let you know ahead of time if your MRI scan will be done with or without anesthesia. If you have any questions or worries, please talk with your medical team or your child life specialist. Thank you for watching.